Hello friends, I'm Dr. Vijay Prakash and today I'll be talking to you about border molding in a patient with a limited mouth opening where we have a oral submucous fibrosis and changes due to smoking, heavy smoking. So we have a known case wherein the patient smokes around 20 BDs per day since 20 years. So we'll just open the jaw and see what's in. मुंह खोलिए. So you can see there is lots of stains. Can you see the palate? This is a smoker's palate, and you have changes here. You have thick bands. These are the changes on the buccal mucosa, and you have a look with the lower jaw. Similarly on the other side. So it will be quite challenging to do border molding in such a patient. So let's attempt that. These are the spatial trays, the upper spatial tray and the lower one. So I'll just check it inside the patient. Okay. So when we are checking, one thing which see, this is very hard. This tissue is very hard, as we can expect in a oral submucous fibrosis patient. And you see this is the frenum. It's a high frenum. You have to relieve this frenum like this and open. मुंह खोलिए. बोलो. You have to see the extent of the denture. So slight interference here. User can just trim it so that you have enough space for the border molding. Okay, on this side, left hand side, we'll do it. So you check the lower tray. जीभ को ऊपर लेके जाओ. तालू से लगाओ. Slight lift is there, so we can just trim this palatal, the lingual aspect. जीभ को दाएं बाएं लेके जाओ. So once I have done the corrections, I will be starting with the border molding. I'll be using green stick compound and I'll be doing border molding with sectional method. मुंह खोलो. थोड़ा गरम लगेगा, ठीक है? So we place it here. ढीला छोड़ो, ढीला छोड़ो. So it will be very difficult in such a patient to do border molding. आराम से, ढीला. So a motion will be outwards and downwards and sideways. And add on the margins of the tray and then temper it in hot water. ढीला छोड़िए. And then do the movements outwards, downwards and inwards. Outwards, downwards and inwards, and also sideways when we are doing in the buccal frenum region. So you remove this excess like this, whatever has flown inside the impression surface, and again add here from here onwards. Heat the compound. ढीला छोड़ो. Side. ढीला छोड़िए. Same motion, same movement. So add it in this region. This is the distal buccal region. ढीला छोड़ो. Keep it loose. Keep it loose on both the sides. मुंह खोलो. बड़ा मुंह खोलो. So since he is having restricted mouth opening, he will not be able to do much. जबड़े को दाएं में लेके जाओ. जबड़े को दाएं में लेके जाओ. So you have to ask the patient to make sideward movements when you are recording the distal border. मुंह खोलो. बड़ा मुंह खोलो. ठीक है. बंद करो. ओपन. मुंह खोलिए. Now here we will be using the T-burnisher and checking the resiliency of the tissue. So when we are checking the resiliency, just go along like this with the ball and this T-shaped instrument, and when we reach here, you feel the depth, that is the hamellar notch, and you come towards the midline. You check the resiliency here. Can you check? From this edge, you come towards this in the posterior palatal seal area. Just palpate this. In the center, the resiliency will be less, of course. In the mid-palatal region, as you go again towards this, resiliency increases. So you have the maximum resiliency here of the tissues, and as you come towards the ridge and hamellar notch on the other side, again the resiliency reduces. So I will be adding the material according to the resiliency in the to record the posterior palatal seal area. First you add on this area, and as if you remember correctly, the resiliency was less in the midline, but it was more as we were going from the midline towards the hamellar notch region. Just somewhat like this. So you add more material here. The green stick. Just soften this more so that you have a better record. Temper it in hot water. Just press like this. जबड़े को दाएं में लेके जाओ. Ask the patient to make lateral movement. Also, you apply pressure in these so that the resilient tissues can be displaced slightly, and non-resilient tissues are not displaced. So this method wherein we are doing the border molding is for selective pressure technique, that's the impression technique, wherein we are applying pressure in the pressure areas and we are not applying any pressure in the non-pressure or relief areas. So I'll be just checking. Yeah. So we have a good record here. Can you appreciate? Yeah. और पास में. So we will be starting with this now. Before, when we start with the border molding, check the surface should be smoother surface, no sharpness, so that it does not hurt the patient tissues or injure the patient's mucosa. So we'll add from this lingual border alveolingual sulcus. Since retention will be a problem, then this part becomes very crucial when we are recording. Place it inside. जीभ को ऊपर लेके जाओ, तालू से लगाओ. Ask the patient to touch the tongue, tip of the tongue in the palate. बाहर निकालो, take out the tongue. Right and left, दाएं बाएं लेके जाओ. Move the tongue right and left, and again towards the palate. जीभ को ऊपर टच करो, तालू से लगाओ. So more pressure he applies, the better it is. And you have to place the downward pressure. This excess material you are going to remove, which has flown in. We add the material on one side of the border, temper it in hot water like this. Take it inside. जीभ को ऊपर लेके जाओ, दाएं बाएं लेके जाओ, दाएं बाएं ऊपर, जीभ को ऊपर लेके जाओ, बाहर निकालो जीभ को, दाएं बाएं लेके जाओ. Ask the patient to move, make functional movements of the tongue. Take the tongue out, move the tongue right and left. इधर और इधर से टच करो. Ask the patient to touch the tip on the buccal mucosa, both on the left and right side. So we will add similarly on the other side. Temper it in hot water. जीभ को बाहर निकालो. We'll repeat the same thing. दाएं में लेके जाओ, दाएं बाएं ऊपर. And also you have to record the mesenteric notch. So when we are recording the mesenteric notch, you have to make sure that you instruct the patient correctly. Open. मुंह खोलो. Position the tray properly. Make the materials have a good contact here. And since I have hard tissue, it will be difficult for me to mold. Ask the patient to close now against resistance. बंद करो. Open. बंद करो. Open, open. Such patients will have a very good masseter muscle, so the force will be good. Similarly, I'll do it on the other side. Position the material properly. Mold it as I told you. You have hard fibrous bands, little difficult for me to mold. Ask the patient to close against resistance. बंद कीजिए, मुंह खोलो, बंद करो, मुंह खोलो, बंद करो, ओपन, मुंह खोलो. Now I will be adding material on towards the buccal side. Just temper it in hot water. Make movements upwards, inwards, and outwards. Mold. ढीला छोड़ो. मुंह खोलो. We'll add material on the remaining part of the tray. You have to be careful with the material. You should not injure yourself, especially those who are beginning with this kind of procedure. Again, position the tray properly. It's very difficult to mold here again. As I told you, the patient is having oral submucous fibrosis. ढीला छोड़िए, ढीला छोड़ो. हाँ. मुंह खोलो. Having this, so I have some excess material here, so I'm going to just excess material here. This step should not come. I'll mold this again, this part, more thicker material here, and that seems pretty okay with the given condition. Again doing the molding in the buccal region. Thick tissues and restricted opening of the jaw. Okay. So once we have completed the border molding, I'll be removing these spacers and the spacer designs, which you can see with the modeling bags, and I'll be making vent holes in the center here according to vouchers here, here, and one maybe on the sides we can give, so that we have an easy flow of the excess material. If we talk about the lower, there is no need to give any kind of, make any kind of vent holes. So I'll just be removing these spacers and directly making the impression. So now I just remove this and I'll show you. So just soften the wax and it will be very easy to remove with the carver. Just go straight in the center. In this area, try to make a larger one because it is better, because this is one of the commonest area where you will find air bubble incorporation or the material does not flow. One in the center, in the mid-palatal region. As we all know, this is non-pressure area. Tissues are not that resilient. One here. And on the sides also we can create vent holes, because our aim is that there should be no excess pressure built up there, and that may result in air bubble incorporation or the material not flowing completely. So this is how it is, and as I told you, in the lower it is not required. All paste, equal lengths of eugenol, and since I have to do for the upper, this much should be enough. And then I'll be taking the catalyst paste. Yeah. Now, in order to increase the setting time, I will be adding small amount of Vaseline. You can just add here, so you get more working time with the material. Now, how to mix it? It's very simple. You use just so once I have mixed it, I will be getting a smooth mix. Can you see this? And just load this smooth mix onto the impression material, the water molded tray, like this. Make sure that you have enough material everywhere, so that you don't leave out any chance that the material is not going to flow properly. The excess anyhow will be coming out. So you see there is no streaks of any kind of eugenol or base paste anywhere. Yeah, this is ready. Now we are going to make the impression. So first allow the material, so you can see the excess material coming out. Yes, and allow this material, mold this all around this excess material. Whatever molding technique you have followed, you will be using that. ढीला छोड़ेंगे, downward, outwards and inwards, and sidewards in the buccal mucosa region. Ask the patient to make jaw movements. अपने जबड़े को दाएं में लेके जाओ. Good. ढीला छोड़ोगे. Make sure you have excess material flowing out. Keep molding, because usually what happens, once you stop molding, then this material, again the flowy part will hamper that, and excess, you will find the excess material in the border area. So once this material is set, then you will be removing this. Yeah, you have a lot of saliva, you have to wash. So once we have completed the upper impression, we go with the lower impression. Similarly, I'll be mixing the material, the zinc oxide eugenol paste. In this case, I will be taking lesser of material because not much is required. Similarly, I'll add some Catalytum jelly so that I increase the working time. And the mix is similar as I showed you before. So well mixed material I'll be loading everywhere in the tray. This is how I'll be doing that. Go from one end to the other when you're loading the material. And as I told you before also, no place should be left vacant. Place it in position. Excess material will flow out itself. Make these border movements as you had done previously. जीभ को बाहर निकालो, दाएं में लेके जाओ. सो फंक्शनल मूवमेंट्स ऑफ द टंग. जीभ को तालू से लगाओ, ऊपर बाहर निकालो, दाएं में लेके जाओ, ऊपर तालू से लगाओ. बंद करिए, बंद करो, ओपन, बंद करो, मुंह खोलो. Material is completely set. We'll be removing this. So you have a good liquid retention. I'll wash this and show you. This is the final impressions, both the maxilla and the mandible. With this we come to end of our presentation. Thank you for watching the video.